For surgeon training, we're going to find out if a 3D print holds up in a pinch. And we're advancing you right now. First, let's talk material. Usually surgeons use sawbones. They mimic bone property. When designing, engineers use polymers. This is required from the FDA. But in a pinch, what about 3D printing? Well, let's take a look. For apples-to-apples comparison, this is a material that already is used for training. We don't have access to this material right now, and we want something more practical, so it's a good place to start. We find the material property, so we're going to try to come as close as we can with our material values. We want to select a material that's fairly easy to get and inexpensive. We're going to use PLA for our material because it's close enough. Next, let's get a reference. For that, we go to the journals. This article is the example we'll use. Notice the region. We're going to print L5. Also notice the length. So we'll set up a screw similar to that. Take note of the implant. We're going to find one similar to that. Next, we look at insertion torque. We're going to go with single. In a future episode, we'll compare both. Let's take a final look by comparing in the cloud. Type in the two values. And we can see where we are relative to other journals and even other segments. Now that we know our limits, we prepare the model. Next up, we'll take a look at technique. Until then, keep advancing.